I, Nurse Linda, thought of the day. Today, let's talk about symptoms of miscarriage, or symptoms that we're afraid are going to cause a miscarriage. Obviously, spotting is going to be the number one thing. Now, in about 40% of pregnancies, we have spotting. Generally, it's just maybe a little bleed from the cervix, could be from sex, could be if you had a recent ultrasound, could be exercise, could even be a bowel movement. I always say the cervix is like our gums. Sometimes they bleed very easily, and it doesn't mean I have a bleeding ulcer. It just means my cervix is bleeding. Now, this bleeding could be pink. It could be brown, which is older blood. What I do worry about is not this spotting episode. You wipe and you see something. I worry when there's a trend, like, say, a period is an example of a trend where bleeding starts maybe as spotting, and then it progresses, I need a panty liner, and then before you know it, I'm passing clots. That's the kind of trend I don't like when you're pregnant, though I have seen pregnancies be perfectly fine after that kind of bleeding episode. But that's when I certainly want you to get checked out. I want you to know, though, if anything like this happens, and at 2 a.m., people have spotting, like, well, run to the ER. There isn't anything anybody's going to be able to do to stop a pregnancy that's going to be lost. But the good news is there's not anything you or anybody else can do to lose a healthy pregnancy unless you take medication or an intervention. Hold on to those babies. I love you guys.